body contouring is a collection of surgical procedures, which includes liposuction, skin removal, fat removal, to improve the body of a patient. The areas that are most commonly requested are arms, brachioplasty, thighs, inner thigh lift, upper thorax and breasts, breast lift, breast reduction, and the most commonly requested procedure is lower abdomen abdominoplasty or extended abdominoplasty or 360-degree abdominoplasty. Most of the patients that want body contouring have either had significant weight loss or multiple pregnancies or a combination. In the first world countries, obesity is a big problem, and the emerged specialty of bariatric surgery and the new release of injectable drugs such as Ozempic and Wegovy have made significant weight loss a possibility. And after people have lost a large amount of weight, then areas of their body no longer look or function normally. So hanging, wobbly, floppy tissues, which interfere with activities of daily living, or get infections in folds, smell in hot summer months, are the main concerns in the weight loss population. So the commonest areas treated is abdomen, number one, and that can extend from the front of the tummy to the flanks as well, called an extended abdominoplasty, or in fact all the way around the lower trunk, called a 360-degree abdominoplasty or belt lipectomy or lower body lift. Same thing, just slightly different wording. After the abdomen, the upper chest, so breasts and flanks, lateral to the breasts, are also affected in patients that have significant weight loss. The breasts become more droopy and upper flank folds develop. These can extend all the way around to the back. And so a breast lift or mastopexy, but also extended and 360-degree to the upper trunk is possible as well. And then finally, the other two common areas that people request body contouring for is the upper inner arm, brachioplasty, or the upper inner thigh, a thigh lift. And when people lose a lot of weight, these are the four areas that most bother them. Often when I address these, it is not possible to do it all in one go because the amount of general anesthesia and risks of a prolonged operation change the balance of benefits and risks. So mostly what I do is do these four areas in two separate procedures, usually starting with the tummy and the arms, followed 6 months later by the breasts and the inner thighs. We have two surgical teams that work together with this to try and keep the general anesthetic and the operation as short as possible. I think it would be good to divide the benefits into functional benefits. So this would be easier activities of daily living, easier sporting activities, clothing fits better in patients who have had body contouring after weight loss. And then, of course, the benefits of improved mental health, because patients after significant weight loss have areas that they are very unhappy with, and looking at these areas every day in the mirror can be a significant negative effect on the mental health. And the body contouring, which removes the wobbly tissue, lifts and tightens the tissues, and restores the patient back to a normal body physique, has both significant functional and significant mental health and significant cosmetic benefits for the patient. The risks are lengthy, and your consultant should go to go into great detail about the operation, the recovery, the benefits, and the risks. It is important that any patient considering body contouring surgery is fully informed, and only when they are fully informed are they actually able to give consent to the procedure. So normally what I would do is discuss all of these in two separate consultations. And in the first consultation, I'm just establishing whether the surgery is right for the patient, or if indeed the patient has significant comorbidities, diabetes, hypertension, asthma, and nutritional problems, which would need to be optimized before surgery can be contemplated. Um, with regarding to the risks of the surgery, it is probably worthwhile dividing them into immediate or perioperative risks and long-term risks. The immediate risks around these operations are usually things like bleeding, 1 to 5%, infection, less than 2%, asymmetries, seroma, wound healing problems, numbness, or necrosis. And the longer term risks might be an asymmetry or poor scarring, or dissatisfaction with the outcome of the procedure. It did not meet the patient's expectations. Preparing for body contouring um, takes some effort. This is not a short or low risk procedure. Most body contouring operations are done under general anesthetic, usually take 3 hours or longer, require a 1 to 2 night stay in the hospital. So this is a procedure that requires careful thought before embarking on the journey. The best way to prepare is firstly read a lot around the surgery. So I usually direct all my patients to my own website, marksoldin.co.uk, and my two national organizations, the British Association of Aesthetic Plastic Surgeons, BARPS, or the British Association of Plastic Reconstructive and Aesthetic Surgeons, BAPRAS. These three websites will provide a lot of good information, factual information, not marketing, sales information, but important data that you need to read through and understand. And the best thing is, while you're doing this homework, if you like, you have a piece of paper next to you, and you're writing down questions that you would give to me at our second consultation. And once those questions have then been answered, the mental preparation and the understanding of the surgery, the benefits, the risks, and the recovery time will be complete. The other thing to do is to understand that there are simple things that you can do to help the operation go smoothly. For example, if having an operation on your lower abdomen, say a tummy tuck, washing of the area with an antibacterial soap, such as heavy scrub soap, for every day in the week building up to the surgery, and indeed in the morning before you come in for your operation, another thorough body scrub with the antibacterial soap lowers the bacterial count on the skin and means that the infection risk is lower, which is a very important consideration. Of course, the mental preparation for the recovery time is also very important. Um, One of the rare risks after the surgery is deep vein thrombosis, a clot in your leg, which can spread to the lungs, pulmonary embolus. And the best way to prevent that is to steel yourself that early mobilization, an enhanced recovery program, where on the day of the surgery, you are, with the help of the nurses, of course, up and about and walking around and sitting out of bed in a chair. This gets the blood circulating in the calves and the lower limbs and diminishes the risk of deep vein thrombosis. So there are things that can be done to mitigate the risks, and it's quite easy to say it, but when you are after the surgery and you've only just woken up and you're in discomfort, it's more difficult to actually do it. So preparing yourself mentally for the early recovery after the operation, I think, is a critical component of making a smooth recovery after surgery.